Hello, 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 and welcome to everyone who is logging on. Welcome to this very special episode where we are having a town hall meeting today, y'all. We have a lot to talk about in public health and all of the things that are happening, and we wanted to make sure that we took some time to keep our community informed. As you all are coming in, if you'll go ahead and start introducing yourself in the comments, let us know where you are watching from and get your questions ready. Y'all, tonight we are talking about COVID, we are talking about monkeypox, we are talking about our public health. So, this is your opportunity to be able to get your questions answered. We also have the opportunity for you to join us on screen if you would like to ask questions and get your questions answered in real time. If you would prefer to appear versus to type your question, just let us know in the chat and we will chat you the link, and then you'll be able to come on and hang out with us. So, hey, over there, Sab, I'm so glad that you are joining me tonight. How are you?
I am well. Thank you for having me with your space. I'm really excited, and not excited. I'm anxious, but I'm looking forward to today's episode. So thank you for having me and letting me join your space this Wednesday.
Absolutely. So, usually here on Wednesdays, it is Brown Girl Boss Day. And we actually have a returning Brown Girl Boss with us today that is going to help us kind of sort all of this out. But I told Sav, I'm like, hey, come hang out with me so that we can make sure we get our questions answered. You know, on Brown Stations, we try to keep you all informed and talk about everything that's happening. But you know what? We are not doctors. So we do our best. We read the things. We do our research, but we're not in the trenches. So we went out to find an expert to join us who is in the trenches, who is going to be able to give us some insight into what's going on in public health. So I see you all coming in. We have Kat is here from Northwest Arkansas. Welcome. Tonight, Linda is here from PNW. We have Nisi that is here from San Diego. Lakeisha is also here from Tampa Bay, Florida. Now, y'all, we need you to do a couple things for us, okay? Because we want to make sure that we are really taking the time to educate ourselves and educate the people that are close to us. So, what we need you to do is we need you to take a moment right now and go ahead and share the broadcast and tag at least 3 friends. Okay. This is going to make sure that everybody that needs to hear this information has the opportunity to hear it firsthand. So, if you will go ahead and get your people, tag them, share the broadcast on your page, let them know that we are having a special beautiful brown girl town hall regarding COVID and monkeypox, and they have the opportunity to get their questions answered. So, let's go ahead and tag some people, and I'm going to actually take a moment to share again on my page so that I can get my people in here as well. All right.
Same.
Give us just a second. There's so much. And Sab, I know you have like bunches of questions over there as well. And we want to get as many of them answered as possible so that we know what we're talking about when we are out here trying to educate our friends, our family, the people that matter to us. All right. So let me.
Absolutely. And again, if you just reiterate, if they are interested in coming on live, or if you have questions that you have surrounding monkeypox, we're going to be talking a few things today, but specifically monkeypox. If you have questions and you want to come on, say something to you, how do they do that again? Can you repeat that?
So thank you for elevating that again. So if you will let us know in the chat, I would like to come on. And then we'll message you the link for you to be able to come on and ask your questions. Now, everybody might not be camera ready, and that is okay. So, if you would prefer to ask your questions in the chat, that is absolutely fine. We will get those elevated and get those answered. But sometimes our questions can get a little long and complicated. So, if that is the case, you do have the opportunity to come on live with us, come on screen, and ask your questions directly. So I don't want to belabor the time. I do want to go ahead and let you know who we have with us here today. So again, good evening. Welcome to our special, beautiful Brown Girls Town Hall today, where we're going to be talking about COVID-19 and monkeypox. Here on BBG TV, we do our very best to make sure that we give you the opportunity to connect with people who are like-minded and people who are on a mission to live their very best lives. We come to you weekly with programming that challenges and inspires you and keep the conversation going to connect with other beautiful brown girls. By no means is the information that we're sharing tonight only for brown girls. So feel free to tag the people that matter, because this town hall is applicable to everyone, and we want to make sure that everyone has that opportunity to share. So my name is Kimberland. I am one of your hosts tonight, and my feet are actually planted in New York City this evening. So Sab, go ahead and tell the people who you are.
Absolutely. My name is Sab Jackson, and I reside in Dallas. I am also one of your co-hosts tonight. Normally I'm one of the co-hosts for Brown Conversations, but tonight I am to have this space with you.
Absolutely. So I see quite a few more folks have come in. We have Isaka is from Northern VA. We have Danita that has joined us from Cleveland. Thesia has joined us from Decatur, and Marie Christie is here from Brooklyn. So again, if you all will pause right now, share the broadcast, tag at least 3 friends, so that they can get in here and get this information. Okay. All right. And I see my New Orleans and Slidell people are here. Welcome, 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 and thank you for coming. So tonight, our guest that we have with us is Dr. Alexea M. Gaffney. She is a triple board certified infectious disease subspecialist, internist, and pediatrician. She is a mother, a speaker, an author, and a coach. Alexea actually was here with us on Beautiful Brown Girls TV before. She is a breast cancer survivor, and she shared her story about what that process was like. One of the things that Alexea is extremely passionate about is making sure that people who look like us have the information that matters to us, so that we can ensure that we are putting ourselves in the best positions to live our very best lives. So tonight we have Dr. Alexea with us. She has come out of the trenches, y'all. She has been in the trenches. Okay. So she's taken some time out of her really busy schedule to come and hang out with us and give us the opportunity to get our questions answered. So if you will go ahead in the comments, welcome Dr. Alexea to join us. Hey there, Dr. Alexea.
Hey, thanks for having me on.
Absolutely. So excited. When we were trying to think about who could help us sort all of this stuff out, you are the first person that came to mind. And I have been watching your lives that you've been doing on COVID-19 and on monkeypox. And I just knew you were the right brown girl for the job.
Yeah.
So thank you for accepting the invitation to hang out with us tonight.
I'm excited to be here. And as you said, I am so passionate about making sure that people who look like me, people who I relate to, people who I'm connected with directly and indirectly have the appropriate information. Because when it comes to anything that pertains to our health and wellness, COVID-19, monkeypox, cancer, diabetes, high blood pressure, whatever it is, Black folks are always at a disadvantage. And even Black women are at a greater disadvantage. We're
Mm.
overlooked, we're underserved, and we fall in the highest risk. Part of that risk is sort of, um, I want to say inherent to us, but it really isn't inherent to us. It's a complication or an outcome that's really based in systemic racism. We just feel it the most. We experience
Mm.
it the most. We are the ones who suffer the most consequences, when it comes to COVID-19. Before we really even get into it, just, one fact about COVID-19 and Black women. Men in general are more likely to die from COVID-19 than women. Yet
Mm.
Black women are twice as likely to die from COVID-19 in comparison to white men, right? So if I'm twice as likely to die from something that, as a person living in a female body, should be more likely to survive, why am I dying more? And if I'm
Right.
dying more, then that means I need to be even more hyper vigilant, more aware, and protect myself even more from this thing. Because COVID is still COVIDing, y'all.
Yeah, and that's where I want to start, right? Because I feel like, I have been frolicking about the earth lately, and in my frolicking, I have seen such relaxed measures regarding COVID, right? So, folks are not really wearing masks anymore. The hand sanitizer stations are
Okay,
empty.
empty. Right.
So it's like the panic has gone away, and I really wanted you to start with kind of giving us the inside info. Is COVID still out here COVIDing,
It
and how
is.
should we be comporting ourselves? Because I feel like we've gotten really, really lax and really comfortable.
Yeah, I have not let down my guard when it comes to COVID-19. I still come and go in a mask. You will not catch me in Target, the grocery store, the pharmacy without a mask on. If I'm entering into a space where I don't know everybody, I don't know who all gonna be over there or who all over there and what their habits are around COVID-19, I'm either not going or I'm going with a mask on because COVID is still very present. I mean, just to give you some numbers, in the United States, there's been almost 90,000 new cases of COVID-19.
Hmm.
90,000 new cases of COVID-19 between July and August. That's a lot of people. And
Wow.
our daily death rate from COVID-19 has been anywhere from about 200 to upwards of 400 people a day in America still dying from COVID. And it's because people are not taking it serious. People have this false belief that the pandemic is over. We don't really need to worry about that. People have this false sense of safety. They think it's just like a cold or a flu now. It's mutated so much. I don't need to be worried about it. But people are still dying from COVID-19. Our daily average for new hospitalizations due to COVID-19 is about 5,500 people per day. That is a lot of people.
Can
Okay.
you compare that, Dr. Alexia, to what it was like at the height of when we
Mhm.
were all like so vigilant? Are the numbers
Yeah.
drastically reduced, or yeah, kind of
I mean, they are. There were times, right? And there were certain peaks where we had a million new cases of COVID in a week. There were, times where we had 250,000 new cases of COVID per week. So although the number overall is smaller, 90,000 is not a little bit of people.
right?
200 to 300, 400 American people dying every day is not a little bit of people. And, it's more than just did grandma die or grandpa die or whose mother, son, cousin, uncle died, right? When you think about when we lose a family member, did they have life insurance? Did they have health insurance? Are we going to be left with staggering medical debt? Were they the primary breadwinner in our household? And now a family is going to be left scrambling. What child at what age is losing a parent, a sibling? These deaths are catastrophic, and they affect more than just the poor soul who lost their life, especially in
Right.
our community. When we lose a loved one, it can really rock our world. It can really financially devastate a family. It can decimate a household. And, we have to really pay attention to who is dying, right? Because when it
Mm.
was everybody, when it was everybody dying, when everybody was at risk, when everyone was vulnerable, there was a different response to it. And when you think about who's vaccinated and who's not, we are amongst the lowest proportion of folks who are vaccinated against COVID-19. For some Black communities, the vaccination uptake is as low as 10%. And
Oh,
so
wow.
so that's huge, right? So if we are the ones that are predominantly at risk, and I'm not saying that we are, but in certain areas that will be true. The reason that they're not talking about it, the reason these numbers aren't on the front page of your Google ticking anymore is because it stopped mattering who's getting infected. It stopped mattering
Mm.
right? For the folks who quote unquote did what they were supposed to do as far as going to get vaccinated and protecting themselves, since the vast majority of the country has access, because the vast majority of the country is not covered, I think only about a third of those who are eligible are fully vaccinated and boosted at this point. But I think, the the media response, the political attention has changed because the face of COVID has changed. And I think it's, because it's not financially devastating our country anymore because the dollars are pouring back in. It's less
Mm.
important to people now, but it's important to me because I don't want to get this crap and be taken out of here. I don't want to lose a loved one. I don't want my kid to get sick or exposed unnecessarily. And, I hate to see it, whether it's for my patients or just somebody in my community or just someone I might be directly or indirectly in contact with. More beyond just getting sick and having symptoms and things like that. You still have to quarantine, you still have to isolate. And for people in large households, I know folks who were stuck in quarantine for 30 days, 45 days, because every time somebody
Everybody
else
was
in the
getting it.
household got infected, it reset their clock another 10 days for isolation. So, we have people, who 30 days without an income, 45 days without an
Mm.
income. That can devastate some households. So there's health implications.
Mhm.
There's that significant portion of people who will have long COVID or long haulers, and we can talk about that. And then there's, just the health implications and the financial implications. So it affects everything when you get infected with COVID-19. It's a big
Mm.
deal. And we need to continue to remain vigilant.
Yeah.
Dr. Alexea, you mentioned earlier that this is still very present and people are being lax. So my question to you is this something, it's going on maybe almost 3 years now, maybe 3 years in February, March. Do you see this as COVID-19 as a virus as something we just kind of essentially have to live with and learn how to navigate through it?
Yeah, it will probably be with us indefinitely. But the thing about pandemics, if you look at the history of respiratory viral pandemics, they kind of have a longevity where things are at a peak and where things remain dangerous. So the thing that most closely resembles COVID-19 would be 1918 Spanish flu, right?
Mhm.
And 1918 Spanish flu took about 5 years before it really sort of petered out. And they experienced the same thing we experienced, right? They had this really high death rate, and people got vigilant. People had to wear masks. You couldn't hold hands in public. People were quarantined. You would be arrested if you went without a mask or you held hands or did any public display of affection. And when the numbers went down, some of the larger cities like Philadelphia and other places, they actually held parades and mass public gatherings. They were outdoors, but still, those public gatherings in celebration of decreased numbers resulted in hundreds of thousands of
Increased numbers.
preventable deaths, right? Their numbers shot up. And we're kind of mimicking that by just carrying on as usual. That being said, I'm not locked up in my room, okay? I did the summer things, but I don't walk through the airport without a mask. I don't sit on an airplane without a mask. If I'm dying of thirst, I might lift my mask for a little bit and, knock down a cup of water or something like that. But I really don't travel like the pandemic is not happening. I disinfect everything that I'm touching. And I really, really am vigilant about hand washing and not touching my face and not eating without cleaning my hands and being after my daughter. And, people look at me like I'm a freaking loon. And I, I'm just not willing to my life, my health, and my little black body. I'm not willing to rely on somebody in an American health system to value my life and save it if stuff gets really
Mm,
bad for me. I've been
mm,
vaccinated, and as far as my personal experiences, is giving what it's supposed to give and it's doing what it's supposed to do. But the reality is, even vaccines are not perfect. So we need to know that if we come down with COVID-19 symptoms, we need to test. We need to know if we're positive or not. We need to isolate ourselves from people. We cannot assume it's just a cold because the symptoms aren't bad, because you may cruise through it, but somebody else may die or end up hospitalized or have a blood clot or have a stroke or a heart attack or abnormal heart rhythm. All of these things that really devastate people's lives in the short term and in the long term. And then there's still death that's on the table for so many
yeah.
people. So it's a lot to think about. And it's like all of those things that are constantly buzzing in the back of my mind that makes me make sure I have a mask every time I walk out of my house, make sure my daughter has a mask every time she walks out of the house, making sure that we are keeping our friend circle really tight and making sure that we're hanging out with like-minded people. I'm not
Hmm.
hanging out with folks who don't think this thing is real or don't think that it's that we should consider. And thank God for spring and summer and beaches and backyards and patios and things like that. Because outside of my family, I haven't really been all up in my friends' houses. We hang out
Mm.
outside. We've taken up quite a number of outdoor activities, and it's a thing to do.
Yeah, wow. So, one of the things that you said that is kind of just ruminating in my mind is you said that the face of COVID changed, therefore the narrative shifted, right? And I felt that like in a real way because of all the systemic issues that we experience in our brown bodies,
Mhm.
that it makes all the sense in the world why all of a sudden the push was, oh, it's fine, everything is fine, right? Because that is often where we find ourselves as Black people, of not being at the top of concern when
Mhm.
it comes to different types of diseases.
Yeah. Yeah, we're never on the priority list, right? We No matter what condition you're talking about, heart attacks, diabetes, breast cancer, colon cancer, lung cancer, you name it, we always have the worst outcomes. And part
Mhm.
of those worst outcomes are because people just give up on us. People just overlook us. People don't address our pain. People don't address our symptoms. They don't take our complaints seriously. That, there's still significant number of medical doctors and medical students who think Black people have thicker skin and can therefore handle more pain, you know. Um, and for us as Black women, there's that whole angry Black woman trope. We don't get to be in pain. We don't get to be short of breath or struggling to breathe. We get perceived as being dramatic and being angry, as opposed to our symptoms just being addressed for what they are. So we have a lot of really negative and adverse outcomes, because we don't get the care that we need and deserve, because we're not part of clinical trials when things are studied. So we don't get to experience some of
Mm.
the benefits of experimental therapies and treatments. But also, we don't know how those drugs will work on us or work in our body.
Mhm. Mhm.
So that's a big problem too. And of course, we're skeptical because we haven't had a great relationship with the medical community, and certainly not with the investigational community. But that is something that a lot of folks in this day and age are working on repairing, so that we can have true health. Um,
Right.
so it's a big deal. It's a big deal.
Yeah. So Lakeisha has a question. She says she got COVID in June.
Mhm.
How long do antibodies typically last before considering the second booster?
So, on average, from natural immunity, you can start to see antibodies start to wane after about 90 days or 3 months. in the beginning of the pandemic and when vaccines first became available, they were suggesting that people who had a recent infection wait 90 days because it was felt they had some natural immunity, and we should let the folks who have no protection at all, kind of jump the line and get vaccines. Now vaccines are very readily available, so you don't actually really have to wait. So I've had patients go and get boosted in as little as 2 weeks after having an infection, as long as they were symptom free. So if you had your infection in June, you would certainly have had a significant enough window of time in order to go get a booster now, if that's what you're choosing to do. And barring any complications or reasons that you couldn't get a vaccine that I wouldn't be privy to. So we don't have to have that significant wait. The interesting thing with COVID-19 is that in those people who experience really severe infections, and maybe in people who experience milder infections, there seems to have been like a hit to the immune system from the infection itself. So people were more susceptible to additional infections, including bacterial, respiratory infections. So people were getting bacterial pneumonias on top of their COVID viral pneumonia, or sinusitis, or bacterial bloodstream infections, UTIs, you name it. And then the way COVID behaves in the body, it activates all of these inflammatory pathways and all of these immune pathways in a very exaggerated way. And that's part of what gives people long COVID, long haulers, post-COVID syndrome. But we're seeing like these autoimmune phenomenon in some people where they're having completely new and different symptoms they've never experienced before. Joint swelling, rashes, muscle aches, muscle weakness, fatigue, chronic headache, visual disturbances, brain fog, nerve pain, head to toe symptoms. And so even if you had just a mild cold, what's on the other side of that? Are you going to be in that group of people who has long COVID? Are you going to be one of those poor folks who loses their sense of taste or smell for a couple of weeks, couple of months, or for people who've never got it back? I have patients for years haven't tasted or smelled a thing. And that is dangerous. It's problematic. It sucks the pleasure out of life. Like, think about how pleasurable it is to eat or to light a candle and have aromatherapy. Think about, if you didn't know you had a little BO and you just went about your business. Like, there's so many implications.
Yes.
I know someone whose home was on fire. They did not even smell the smoke. It wasn't until the visible smoke was pouring in from the other room and the fire alarms began to go off that they realized that their home was on fire, but they did not smell smoke. Like, that is so dangerous.
Yeah, wow. I'm so glad that you've laid this out for us, because again, we don't want to get comfortable and wind up in situations where we're putting ourselves more at risk than we have to. Roberta is taking us right to where we wanted to shift over to. She said, what about monkeypox? What are the chances of this becoming as popular or prevalent as COVID? So if you could kind of start us off with just sharing what monkeypox is, what you're seeing, and just kind of give us some baseline information, because I feel like there are so many narratives out there about monkeypox, and we need the truth.
Yeah, we do need this. So monkeypox is part of a virus family called the orthopox virus family. And the other big member of that family is smallpox, right? Smallpox and monkeypox are both viral infections that predominantly have symptoms involving skin. And it's those pock marks, or those, little raised, firm blisters, fluid-filled bubbles, papules, however you want to refer to them, that occur in different crops or clusters over the skin. Typically, they predominate at the site where the person was infected or inoculated, and then they can spread out from there. But they don't only go on the skin. They can go on the palms and soles of the hands. Not many rashes do that. So that's one of the hallmarks. They can go inside of the mouth. They can go inside of the eyes, and that can be dangerous because It can actually really cause a lot of inflammation. It can scar the eyes. It can cause visual disturbance or even blindness. And then you can have lesions like in the vaginal mucosa or the rectal mucosa, and that can be incredibly painful. So there's lots of complications that can arise just based on where you have the lesions. When symptoms present, they can present actually in a couple of different ways. Somebody might first start with feeling ill or having what we call flu-like symptoms, right? But we say everything has flu-like symptoms.
Right.
You need to just call them what they are. Sick symptoms, right? When you feel sick in your human body, you get fever, muscle aches, joint pains, headaches. With monkeypox, you may have swollen glands or lymph nodes, so neck, armpits, groin area. And it could be generalized, like all of those areas could be involved, or it could be localized to the region of the body where you have the most pock marks or where you first became infected. And then so that can be the first set of symptoms. And then anywhere from 4 days to 2 weeks, someone may develop the rash. People can have a varying appearance of the rash. It could be innumerable lesions. It could be a small cluster of lesions. It could be just one or two lesions. And we've seen every variation of that. Some people don't even have a rash, and that is especially true for the cases where someone may have been exposed through kissing, oral sex, any sort of penetrative sex, so vaginal sex, rectal sex, or just the skin to skin contact that is associated with that, right? Sometimes people have lesions in the genital region, which, how thorough is your doctor, nurse practitioner, PA that's examining you, right? Are they doing a genital exam? Are they doing a rectal exam? Are they requiring that you get out of your clothes into a hospital gown so that they can give you a good head to toe exam? So early on in this outbreak, when men who have sex with men or gay men were having rectal lesions, they were going to emergency rooms complaining of this severe rectal pain, genital pain, etc. Nobody was looking, or they were giving them like a standard STD swab. And when that came up negative, they said, okay, nothing's wrong with you, go home. And so these people were left suffering for weeks because the symptoms can last 2 to 4 weeks on average. So people were left in pain. People were left, um, having more complications from the infection because their symptoms were not being addressed or taken seriously. And that's dangerous. And part of that is because we're seeing the cases predominantly right now in a marginalized community. And when people are taking, like, we don't call communities marginalized for nothing, right? These communities that are left behind, stigmatized, mistreated. And the reality is that this is not a disease of men who have sex with men. This is not a disease of gay men, gay middle-aged men, etc. Right? It just happened to land first in that group of people, right? So if I was patient zero and I was the first person to get monkeypox in the United States and I spread it amongst my people, then monkeypox would be a disease of Black women physicians or women
Right.
professionals or Black women entrepreneurs. Would they stigmatize it if that was the case? Maybe, maybe not, because it's us, who knows? But if it had landed in Wall Street bankers, let me let you know, they would be pulling out all the stops to make sure that these moneymakers got well and did not have any stigma, any burden associated with getting the care that they need or getting their symptoms worked up or addressed. So we talked about like what the symptoms can look like and where the lesions can occur. Um, more than just having the rash, the thing that we worry about, the thing that makes us in the medical community and in the public health sector be alarmist about monkeypox is, first of all, people are sick for 2 to 4 weeks, right? So it means you're isolated, you need to be locked down, you don't feel well, you're not working. People are probably not teleworking with monkeypox. The rashes are scarring. Some of them can be very disfiguring for some people, so there'll always be evidence of that for some of the folks. And then there's rare cases where people end up with things like encephalitis, so involvement in the brain and inflammation that can be permanent. We talked about eye damage. People can get pneumonia or pneumonitis, so inflammation and scarring in the lungs. And then people can get bacterial infections of the skin on top of the viral infection, right? Because now the skin is
Mm.
inflamed, it's blistered, and those blisters will ultimately rupture and leave ulcers. So if bacteria get into those open wounds, now you're at risk for cellulitis or skin and soft tissue infection. A small portion of people can end up with sepsis, which can make you critically ill and is life threatening. And then there's certain groups of people who are even more at risk. So, of course, immunocompromised people at risk. And we know that from COVID, right? We know who our immunocompromised groups are. Children under 8 years old, highly susceptible to having severe illness and complications. Well, people with eczema in general, right? Because they already have a chronic skin condition. They tend
Mm.
to have bacterial colonization of their skin. So now you introduce a virus, that skin that's already inflamed and, at baseline harboring bacteria becomes infected and more inflamed, then they can do really poorly with this infection. Pregnant women, pregnant women, pregnant women, pregnant women. Whenever we're
Mm.
talking about viruses, pregnant women are always at risk. Pregnancy is a relatively immunocompromised state, right? Because we're growing another human being that doesn't have half of our, doesn't share half of their genetic code with us. So our body naturally suppresses the immune system in order to protect the baby. And there's 2, 3, 4, however many lives online, depending
Mm.
on, how many fetuses are present in a pregnancy, right? So mom's immune system is low to protect her baby, but it makes her even more vulnerable to infection. And then monkeypox is a virus that can be transmitted to the newborn via the placenta. So we call that vertical transmission. That can happen. And when you think about how do we care for a newborn, right? It's skin to skin contact, right?
Yeah.
Baby's
Oh.
breastfeeding, is laying on our chest, we're snuggling, we're bonding, we're doing the eye contact. Well, one of the primary modes of transmission of monkeypox is skin contact. So you have to separate the newborn from its mother if they're born to a mother who has monkeypox, so that if they didn't already contract the virus, the mom doesn't then give it to the baby. So, breastfeeding is
That's a
out
perfect
for the
segue.
duration of mom's illness.
Go ahead, Seb.
That's a perfect segue, Alexia, because you mentioned a few things here. You talked about just not stigmatizing people, but then you also talked transmission. So I'd like to talk transmission, if you
Yeah.
will. So can you tell us how easy is it to get pox? And I really appreciate the educating us on not stigmatizing one particular segment or community. So I heard about a report of a woman getting it through touching money and
Yeah.
handling money at a gas station. So again,
Yeah.
how easy is it or not easy is it to try to get transmission of monkeypox?
So very easy. So monkeypox can be spread through respiratory droplets, right? So it's not airborne. It's not floating in the air like COVID does. But if you and I and Kim were sitting at a desk, sitting at a table, having dinner in close proximity to one another, and we're chatting, those little spittles that sometimes fly when you laugh real hearty or when you cough or you sneeze, those large respiratory droplets can transmit COVID-19. So the young woman in Georgia, right, who worked at the gas station and wasn't wearing a
COVID-19 or
mask,
monkeypox?
monkeypox, excuse me, monkeypox,
Okay.
monkeypox. I apologize. I'm so used to talking about COVID. Um,
No worries.
Monkeypox absolutely is respiratory droplet spread. So the young woman in Georgia who worked at the gas station, she had a predominance of her lesions on her face and around her mouth, right? And she said she wasn't sure if she got the virus from handling money, which is absolutely possible. We'll get into that. Right. So she could handle money and then maybe touch her face or have something to eat and then end up with lesions primarily around her mouth, or just face-to-face contact, talking with her customers, right? Somebody sprays a few little spittles and they land on her face, whether they're even large enough for her to recognize, um, and she's inhaling those respiratory droplets that can transmit the infection. So this is a big deal, and we have to stop with the mislabeling and calling this a sexually transmitted infection. Yes, sexual activity has been implicated because of the skin to skin contact or the genital contact, but you don't need to exchange body fluids like other STIs, right? You you can just be talking and have close personal contact. So think about, you go to the bar and you're chatting it up with a stranger for 15 or 20 minutes. If they have monkeypox, they can give it to you. Touching, shared surfaces. So it shouldn't be like a quick turn of a doorknob, but think about travel, right? Sitting in an airline seat with shorts on. Like I when I travel, I wear pants, I bring a hooded sweater, and I put it on the airplane, because I don't want my skin touching the seat. Pre-monkeypox, I was just disinfecting the armrest, the window, and like the tray table and the stuff in front of me, right? I left Martha's Vineyard midweek last week, and I went straight from the beach to the airport. So I had on shorts, I had on a crop top. I never traveled that way. Let me tell you, I pulled my cancel card. I got on that airplane early, and I disinfected every inch of that chair, and I stood and let it dry out because I was not going to sit for an hour with my skin on a chair that I don't know who sat in it before me, you know? So you can contract monkeypox virus if somebody who had the infection had close contact and prolonged contact with an inanimate object. So, your kitchen countertop, bed sheets, bed linens, towels, washcloths, shared clothing. These are all ways that the virus can be transmitted. So yeah, the handling of money by the girl in Georgia who had no other contact, having no idea where she got this virus from. There was a report in Illinois, 30 to 40 school children
I was
exposed by their
reading
school
or hearing from multiple sources that it's define
Say
prolonged.
that
So
again.
if Kimberlyn and I are next, God forbid, Kimberlyn and I are next to someone who has lesions, active lesions, and I brush up against them, is that me contracting the virus, or does it have to be prolonged skin-to-skin touch of contracting this virus?
Typically it's prolonged, right? But, am I going to put anybody in the room with my monkeypox patient? No. Am I going to let my monkeypox patients hang out in my waiting area and sit on the waiting room furniture that, 10 or 20 other people are going to come pass through during the day? No. Call when you get here, because we're going to make sure the sick room is available. You're going to walk straight into that room. Don't touch anything on your way. And then keep it moving. With the population that we're seeing most of the cases in, some of the infections, hugging, kissing, giving someone a massage, dancing has been implicated in the spread of the infection. And, monkeypox is not related to chickenpox, but I think chickenpox is a very good comparison, right? Think about, we probably all had chickenpox, right? We were not of the generation who got vaccinated. I know where I got chickenpox. I got chickenpox in the girls' bathroom in the 3rd grade from Teresa Vargas. Okay.
Oh, dang.
Listen, that's how bad it was that I will never forget it. Okay. She was out of school for like 2 weeks. We in the bathroom. What happened? Where you been? Why was you out of school? Oh, I was sick. I had this thing called chickenpox. And she bent over and lifted up her shirt and showed us all her pox marks. Sure enough, 3 days later, when we started our spring break, I'm riding down to South Carolina with my family in the car, and I start feeling horrible. Just not feeling well, feeling achy, feeling terrible. When my pox marks started to appear, I was having fevers, headaches, hallucinating. Can you imagine being a child, seeing your dead great grandmother in the dress?
Right.
Okay, so I will never forget where I got my chicken pox from. And, it was, how long could we have been in the girls' bathroom? Right. You went in, you used the bathroom, you washed your hands, you chatted with your friends, and you went back to your classroom. But it was enough to transmit that infection to me. So it can be pretty casual contact. So it can be transmitted by respiratory droplets, not airborne. Airborne is more like TB, more COVID. It can be skin to skin contact. It can be, prolonged contact with inanimate objects. Think about when you go to a bar, right? You lean on the bar, You're trying to get the bartender's attention. You're there for several minutes because it's a line, it's a crowd, especially in the summertime, right? And so you can have prolonged contact with a contaminated surface. We've had reports of hospital or healthcare workers who like clean the bed linens. Or there was a report supposedly from someone who like is one of those cleaning companies, works for a cleaning company that cleans up like Airbnbs and those home rentals. You know, they have the crew come in and they get all the bed linens, they gather all the towels, they bag them up, they throw them in their truck and they take them off to launder them, right? People have reported infections that was their mode of transmission. So you know, there's a lot of risk because there's so many ways that you can contract this virus. And somebody asked in the question, like, could this be like chickenpox was for our generation? Yeah, absolutely, it could be. And our children are heading back to school. I know in Charlotte, North Carolina, there was a report of a school-age child who got diagnosed with monkeypox, and they're just starting their school year. So, of course, there's concern there. I know of a young athlete in the north southeast region who's diagnosed with monkeypox and not even sure where they got it, but this person plays a contact sport. So none of us were protected. There's a very finite, very limited number of vaccines currently available, and currently they are being reserved for the most high risk people, right? So right now they're targeting the LGBTQ community for vaccination because um, you know that's the social network that the virus is predominantly circulating in, but it will not stay there. Men who have sex with men have wives, girlfriends, children, jobs, ride public transportation, and so it is, and we're all susceptible. So it's only a matter of time, that time being now, and we're already seeing it, that it's going to spread in men, women, children, and everybody who is susceptible.
Everyone.
Yeah.
So Linda wanted to know if someone had received, I know you said that monkeypox and chickenpox are not related. So a chickenpox vaccine does not help when it comes to monkeypox, correct?
No. So chickenpox is not a pox virus, it's a herpes virus. So having had a chickenpox infection or having had a chickenpox vaccine offers you zero protection against monkeypox. Folks who may have been in the military, may have done foreign mission work, or are really well traveled, who may have had a smallpox vaccine, they can have protection against monkeypox because, again, they're in the same family. And the treatment that we're using, the TPOX, is a smallpox treatment, but it is effective against monkeypox. That can help protect people, but a chickenpox vaccine is no help. And a lot of people have that false belief. A lot of people have been misinformed. A lot of people have been told by their friends, family members, neighbors, etc. Oh, if you had chickenpox, you don't need to worry. That is 100% false. Chickenpox infection, chickenpox vaccine offers you zero protection against monkeypox.
Wow. Okay, we have another question from Michelle, and she said, is it safe to swim in a community pool? Do we have to worry about the pool water being infectious for either COVID-19 or monkeypox?
So pool water is chlorinated, and it's chlorinated in order to decrease the risk of the spread of viruses, bacteria, etc. But there are some bacteria and parasites that are stable even in chlorinated water. So the way to know is it reasonable to go to a pool or not is to know what is happening in your community. Like, go on your local state, city, town public health and see how many cases of monkeypox are around your community. And sometimes they may even list information about, where the virus is coming up. Like, is it related to a school? Or was it related to sports activity? Was it related to a spa or bathhouse? Was it related to a particular party or event? I would look at information like that to determine whether or not I'm going to my community pool. I would say, in all of the country, right? We're a country of 333 million people. There's only been roughly just under 16,000 monkeypox infections. And so you just really need to know how prevalent they are where you are in order to make that decision.
Okay, that is good information because again, some of the commentary out there is that things like chlorine, you don't have to worry about it; it's fine. It'll kill all of the things, so
Yeah.
that's good to know
Yeah. You could
that that is.
disinfect the surface, right, with Lysol disinfecting spray or with chlorine bleach spray, but that is much more concentrated than the concentration of chlorine in a pool. And,
Right.
who's checking the pool's chlorine levels, pH, all these things, right? So
Facts.
nothing is perfect. So, in order to, you want to make an educated guess, right? So just
Hmm.
what the numbers are like in your community, right? If
Okay.
you're in New York City, right, we have 3,000 cases and counting of monkeypox. Whereas somewhere like North Carolina has only had just under 300 cases, right?
Mm.
And they're probably a little more localized than somewhere not like North Carolina. Certain towns that are um, more distant, less populated, more, kind of sheltered, are probably not going to see much exposure, not immediately.
Mhm.
But
Mhm.
again, ultimately, we're all at risk. Look how COVID spread.
Yeah. Sab, were you about to jump in and ask something?
Yeah, it was a perfect segue to what she was saying. So prevention is what I wanted to talk about. So it seems like we're underscoring some of the same issues that we dealt with COVID-19. Like, should I wear a
Mhm.
mask? Should I be wiping things down more? Should I wear gloves? Like, can I be in the same room with someone with monkeypox and breathe the same air, getting in a hot tub? So can you speak to us about prevention of this? And I realize
Yeah.
this is fluid because I feel like it's going
Mhm.
to change tomorrow. But can you
Yes.
speak to some of the prevention?
Yeah. I
Yeah,
mean,
good
definitely,
question.
just like with COVID-19, right? You bring up a good point. We're learning as we go. Monkeypox is not new. It is just new for it to be
Mhm.
circulating like this in America. The last time we saw monkeypox was in like 2003, I think it was, or 2007. And the predominantly infected folks were dogs and their owners.
Mm.
So, and it was a very small, short-lived, finite outbreak, and probably most people didn't even know that it happened. But because it's circulating more widely, we have to take precautions. So, yes, mask use in public places, indoor places, can help us. And my kid's not going to be happy, but she's going back to school in that mask again this year. And on their school list for supplies was disinfecting wipes and baby wipes, and all kids were encouraged to, have their own hand sanitizer and clean their hands frequently. If I have a high schooler or maybe a junior high schooler who's not sitting in the same desk every day, I might
Mm.
tell them, wipe things down before they sit down at the chair.
Yeah.
In the pandemic, when it first started, lots of federal funds and state funds were put towards having extra crews around to do all of this cleaning and disinfecting. And that's not happening anymore. The
Right.
federal government is just not paying for this. So we have to remember to do these things for ourselves. So, like at the end of our workday, my staff disinfects every surface: computer keyboards, computer screens, the mouses, the phones, all of the hard surfaces of the desk, all the doorknobs, all the furniture. Every exam table is clean, disinfected, and has to dry out between every single patient. And we can sort of do that in our own little lives and in our own little bubble, right? I go to Target and I'm getting my groceries and I use the little keypad. I do not wear gloves in public places, like surgical gloves. I never have, because human nature is to touch our face like once
Right.
20 times per hour.
Yeah.
And people with those gloves on, they touch their face, they're in and out of their purse, but they're also touching everything in the store,
Everything.
everything in public, because they feel my hands are covered, my hands are protected. Whereas somebody who is aware and vigilant, they're just going to disinfect their hands until they get to a sink and wash their hands with soap and water, and they're going to wash their hands frequently. So I don't feel that people need to go out in gloves, because I think it makes people more careless. And now you have these gloves that are carrying all these germs and contributing to the spread of other infections, including monkeypox and COVID. Because nobody's going to disinfect their gloves, but you will disinfect your hands if you push the cart at Target, or if Target gonna have to pay me, or if you just came out the grocery store, you're going to do that. That would be people's natural tendency, or at least I hope it is. But I don't think that people need to wear gloves. I think people need to wash their hands or disinfect them frequently.
So can I ask you, how can we, as brown girls and people that are connected to us, advocate for ourselves? You mentioned, for instance, when the first outbreaks of monkeypox were happening, that people were going in, and because their concerns weren't being taken seriously, they were sent home. What do we need to do in order to be vigilant if we aren't feeling well, or we feel like something is off? Can you give us some insights there?
Yeah. So,
good question.
Call your doctor. I think it's imperative that we all have a medical home, that we all have a primary care provider, whether it's a doctor, a nurse practitioner, physician's assistant, whoever it is, somebody who you have a therapeutic relationship with, somebody who's committed to taking care of you. Because when it comes to crisis, and when, things really take off, do you want to be able to just pick up the phone and say, hey, Dr. G, I got some symptoms and I worried I might have COVID. Can you get me in the next day or two? I'll sit tight at home until you can get me in. Or do you want to be in the miles long lines like we saw at the urgent care centers and emergency rooms for COVID, right? Whether it's monkeypox or whether it's COVID, you can do an initial visit as a telehealth visit, a teledoc visit, a virtual visit. That is allowable. People have been treated and followed up for monkeypox through virtual visits. It does require some hands-on diagnostic testing to confirm a diagnosis of monkeypox. But even if you got face-to-face care virtually and the suspicion was there, then your doctor could say, okay, well, I finish normal office hours at 5 or 6. When the last patient of the day is out the building, I'll bring you in. I'll, get all my personal protective equipment. You have to unroof a lesion that you suspect is a monkeypox lesion, and collect fluid from it or scrub the base of it, of the wound that is left. So, I don't want to do that when people are coming and going in the office. So I will come see you. I'll have you come in at the end of the day, or I'll have you come in on an off day where there's very little people or no people in the office. But you can only do that with a provider you already have an established rapport with. So don't wait till the stuff hits the fan. Try to establish just regular primary care with someone, even if it's just a wellness visit. Hey, I just, I want to just make sure my health is good. I want to do some basic labs. I want to get my blood pressure checked. I want to make sure my heart rate is okay. Get an EKG if you're of age. And now your foot is in the door where you may have access. If you don't have access to a primary care provider, because not everybody does, one thing that the pandemic did give us in healthcare is several telehealth platforms. And you can use any number of them. You can check with your insurance company. You can pay out of pocket, and many of them have very reasonable rates. And they can order labs and direct you to a lab, or have a system where lab specimens can be collected. So, the internet is a beautiful thing when it's a beautiful thing, right? There's a lot of good stuff on here and a lot of bad stuff on here. So we want to use it wisely. So you can absolutely use telehealth services, whether you're talking about COVID or monkeypox or anything else. I have a number of patients who call me, Doc, I got COVID. I had symptoms. I did the swab. It tested positive. We do a telehealth and we treat them accordingly. I don't drag them in to get another test, right? The tests work. But until we get there, I don't think we'll ever have rapid tests for monkeypox. we don't need them, but we do have commercial lab ability and capacity to check for this virus. So we can make the diagnosis, we can make it definitively, and most people will do okay with just supportive care, but you can access treatment like the TPOX, or you can get a vaccine for post-exposure prophylaxis or early part of your treatment, but you need to have care through a medical professional. So even the local health departments, because of the way we found out about monkeypox and the correlation with sexual activity and behaviors, a lot of the STI or STD clinics are very well equipped to take care of monkeypox patients. So that might even be a source of contact.
I love that. Thank you for sharing that, because, and one of the things that you said earlier that I wanted to underscore is when we have sick symptoms, right?
Mm-hmm.
So getting out of the habit of calling it flu-like symptoms, but when we have sick symptoms, honor those symptoms and get to a healthcare professional so that you're able to figure out what's going on. I know, like, I come from the education field. We have been shamed for years about missing work, and you know, they're giving perfect attendance awards and all of those things. And I'm just hoping that we have shifted to a place where when someone is not feeling well, that we give them the space to actually go to the doctor and figure out what's going on, as opposed to trying to push through it, because we never know if there aren't any symptoms, but you are or there aren't any visible outward signs, but you are sick and able to transmit to someone else.
Yeah, absolutely.
Yeah.
I agree wholeheartedly.
So I just want to thank you again for taking this time. This time has flown, y'all. It's like, oh my God, there's so much information, but I want you, Dr. Alexea, to tell people where they can find you, because I know that you are constantly updating your networks about what's going on and what you're experiencing. So can you please tell everyone where they can find you if they have more questions or just want to hear from firsthand what's happening?
Absolutely. So I'm very active on social media, on Facebook, Instagram, and Twitter. All my handles are as they are on the screen, at Dr. Alexea. So DRALEXEA. My website is dralexea.com. You can definitely feel free to reach out to me there. And as information arises, I tend to do quick lives or reels, just trying to disseminate information in a bite-sized manner, so that we get the information out to the masses. I'm a stand for our people. I'm a stand for Black women's health and wellness. I'm a stand for Black people's health and wellness. You know, I love my Black people. I love my BIPOC community, and everybody else is taken care of. So I'm a stand for using my expertise to take care of us and reaching people beyond the four walls of my office. So definitely reach out to me on my socials, at Dr. Alexea. And again, my website is dralexea.com.
Awesome. Thank you so very much.
Thank you.
Whew. This was a lot, but it was necessary, right? It's really necessary for us to make sure that we are getting good information and not just information from the rumor mill. Sab, was there anything you wanted to share before we close out?
No, Dr. Alexea, thank you so much. I know Kimberly, thank you so much for coming on. I still have many questions, but I'm doing my research every day. What are some outlets? Like, I feel like the CDC is no longer a reputable outlet to follow. So, like, should I listen to my community? Who should we be listening to? And I believe you said this a little bit earlier, where you just said we listen to our community and what's happening in our community to really get that accurate, or at least closest to accurate, information surrounding what's going on around us.
Well, your local Department of Health,
anymore.
Or I would tap into even the New York City Department of Health. They do fantastic webinars. They have a very robust YouTube channel. They give very frequent updates. And right now, because we are unfortunately leading the pack in terms of the 48 states that currently have monkeypox outbreaks, we have a lot of very experienced providers and a lot of experienced folks on the ground who are managing this virus. So even if you don't live here in New York, you could certainly just tap into our Department of Health website to get information about it. The CDC.gov is still a great resource, right? Because the thing that we're looking for is we want to understand the symptoms, we want to understand the transmission. And the CDC website is very simple. The information is there, it's very straightforward, it's very manageable information. And then just stay abreast to reputable news channels, you know. When I'm going to look for information, I go right on the World Health Organization website. I check the numbers with the CDC because they're updated every day at 3 o'clock. Because I want to know what the numbers are, where they are. And then I just try to check reputable news sources. You know, I look at BBC and see what's happening in Europe because right now this is a worldwide outbreak. And just like COVID, Europe tends to be a couple of weeks ahead of us. So I look and see what's happening there. What are they reporting in their cases? What patterns are they seeing? Because we can anticipate seeing that in the coming weeks or months, just right behind them. So it's a global society. We're all hopping off of planes. We're free to move about the country and the planet, and people are doing that. And so we have worldwide problems. And so we really have to look to as many sources of information as we can, and we can try to get ahead of things by looking at public health information in countries that are weeks or months ahead of us in this thing.
Yeah, for sure. So I just dropped those links into the chat, you all, if you want to just click directly on them, or just keep in mind the World Health Organization and CDC to get those right now numbers, right now information, as well as your local health department, so that you are able to stay in the know. So thank you again, Dr. Alexea. So appreciate you. And again, you all, you can find Dr. Alexea at Dr. Alexea on all social media platforms, as well as her website, dralexea.com. And that link is also in the chat for you. And we will find the link for New York Health News, and we'll drop that into the chat as well, so that you'll be able to have easy access. I do know that we had a few folks that this was your very first time hanging out with us. So we want to make sure that you all know how to remain connected to us here at Beautiful Brown Girls. So if you go to beautifulbrowngirls.com, that's our main website where you'll be able to check out all of the things that we are doing. We would also like to make sure that you are connected to us on our social spaces. So on our Facebook page at Beautiful Brown Girls, we have a Facebook group at Beautifully Shaded, as well as on Instagram at Beautifully Shaded, and on Twitter at Beautiful Brown U. Also want to make it a point to let you all know that we are now streaming on Twitter. So tonight's broadcast was actually there on Twitter as well. So feel free to point people to our Twitter page as we are out here trying to make sure we reach the masses. Okay. So again, save those links there so that you are able to make sure you are connected to us. We do content like this all the time, you all. We want to make sure that we are keeping you all in the know about everything that is important and everything that is happening out here in this world. So the best way to do that is to make sure that you are connected to us, and we will keep you in the know. Dr. Alexea, as always, just information that is invaluable. Thank you so much for showing up for us whenever we call on you. It is so appreciated. And just thank you for taking the time to share your experience and to give us some insight into what we need to be doing in order to make sure that we are safe and those we care about.
Thank you. Absolute pleasure.
All right, y'all. Well, that is our show. This conversation doesn't stop here, you all. So please make sure that you share this broadcast. You can continue to comment. You can continue to tag people in the comments. This information is important, y'all. So let's make sure that we get it out to every avenue that we possibly can. Sav and I will be back next Monday with our next episode of Brown Conversations. So we may have even more updates for you about what's going on out here in these public health streets. So thank you all so much for watching, and we will see you all soon. Bye.